Hi, it's Erie County Executive Mark Polenkars with another COVID-19 outbreak update from the Rath Building in downtown Buffalo. I want to thank you for joining us here today. And as always, I hope your families are safe and well as yourself. We have a lot of information to go through as we haven't talked to you since Friday. I'm joined by Dr. Gail Burstein, our Health Commissioner, as well as Kendra from Deaf Access Services who will be providing the American Sign Language to you all today. Wearing the glasses so I can read what's on the laptop screen a lot easier that's in front of me while I stare into the camera. I had a little trying to read in the side, read in front. It wasn't as easy, but I'll just break down and wear the glasses today so I can read what's in front of me and what you'll see on the screen a lot easier. As always, we have the provisos with regards to the information that's being presented. It is the latest information. At the time it was put into the PowerPoint presentation, there may be newer data that is being provided and being updated by our Department of Health right now, and I'll get to briefly where I know there is newer data that they're working on right now. But for the latest information, always go to our website, erie.gov/COVID-19. As of 12 p.m. today, there were 4,484 positive cases in Erie County out of 26,783 tested. Deaths were 357. This hasn't changed in a few days. We do anticipate this to go up later today. We do know on the state site that they're identifying over 370 deaths for New York. We usually get the latest data and we'll release it a little later. They're confirming every death that occurred to make certain that the individuals who died actually were county residents. Sometimes people die in our hospitals, but they're not Erie County residents. They may be a resident of Niagara County. They could be a resident of Wyoming or Genesee County. So we'll have that data later. All of these deaths, of course, were lab-confirmed deaths. There's no presumed positive cases in any of these. And I do know an individual who lost their grandparent in the overnight hours. So we do know there are additional deaths since what we originally reported. Hospital data, we are having difficulty receiving hospital data from New York State. We were able to get May 7th's data, and that showed a slight decline of hospitalizations to 199 as of that date. But we do not have the other data. We are getting it directly from the hospitals. We don't know what the issue is with New York State. They keep on telling us they're working on it and it should be solved, but it's not available for us to look at. So I've requested personally from the heads of the hospital groups hospital data, and we're putting that together. Hopefully we'll have the latest hospital data, with today being the 11th, the data for May 9th by the end of the day, and if so, we'll release it. I'm not happy about this situation because it matters in so many different ways for our metrics for reopening, but unfortunately, I can only rely on the data that's provided to us by the New York State Department of Health, and we're having an issue with that. The hospitalization data, this you saw earlier today during the governor's presentation, it shows a continual decline in hospitalizations statewide. As noted, our hospitalization data on May 7th showed 199 individuals in area hospitals in Erie County for COVID-19. That's the lowest amount we've had in some time. First time we've dropped under 200 in some days. And that's why it's very important that we continue to get that data. The percentage of individuals who've tested positive for COVID-19 has continued to drop as we've done more tests, and I'll turn this over to Dr. Burstein to talk a little bit more about what this means and why it matters.
Thank you. So this graph is looking at the number of COVID tests that are done and the proportion of those that were positive, starting from March 14th on the left all the way through last week, May 9th on the right-hand side of the graph. And so we can see that in the blue that the number of people that have been tested each week is growing very quickly, whereas this past week there were over 8,000 people that were tested. So that's great. We're reaching a milestone to reopening. And of those people that were tested, 12.1% of those tests were positive. And so you can see we're seeing a lowering proportion of people who are tested that test positive. So we're hoping that that is reflective of a decreasing prevalence in our community by everybody being good about helping with the social distancing and wearing masks and staying away when you're sick. So that is effective. You can see right there on the graph that is working.
Would you like to handle the antibody testing?
Sure,
too?
thank you. So these are data looking at our antibody tests in that Erie County that have been reported to us by the New York State Department of Health. Remember, antibody testing is just telling us whether a person has been exposed in the past and to COVID-19 and mounted an antibody response. It doesn't mean that you're currently infected, and it doesn't mean that you have protection against future infections, although we all hope that that will be the case. So you can see here are data being presented of the total number of antibody tests, the total number that were positive, and then the proportion that were positive by week, starting on April 25th and then going all the way to last week on May 9th. So you can see in general in the beginning there were a higher proportion of people that were tested that tested positive. In the past couple weeks that percentage has come down to give us a grand total of 7.8% of those who were tested positive. So again, 19 or almost 20,000 tests is a lot of tests, but given the number of people in our community, 900 and almost 920,000, that's still a very small piece of the pie. However, I think what it does tell us is that although we hear about COVID-19, in the news all the time, we're all thinking about it because it's affecting our lives every day. There's still a lot of people in the community that have not been exposed and we know are very susceptible. So that's why it's really important that everybody continues with the social distancing, because a lot of people actually have not been infected, even though maybe they think that they do. That's common symptoms, and so we just can't assume that we're protected at all.
So approximately 2% of the population has been tested for antibodies, and a little less than 8% have tested positive. We anticipate that number will probably stay somewhere around that, and that means, as the doctor noted, that over 90% of the individuals in Erie County have not contracted the coronavirus. And that is something that concerns us with regards to reopening, because we want to make certain that we limit the exposure as much as we can so that we can keep the hospitalization numbers down. Now, recoveries and active cases, we continue to have a lot of issues with this, people asking about recoveries. I'll turn it over to Dr. Burstein to talk more. But if you want a perfect example of what we're talking about, my friend, the Tonawanda supervisor, Joe Eminger, had a case of COVID-19, very public case. He talked about it, put on his Facebook pages, the difficulties he had in recovering from it. He was in isolation for 2 weeks. He was feeling better. His doctor released him saying he was okay, and then about 7 to 10 days later, he started feeling sick again, to the point where he decided he better get tested, and it turns out, yes, he's still positive. He never really recovered, even though he was deemed recovered. It's not like he contracted the case again. We believe he still just had the original case in his body. We don't know exactly how long it takes for someone to truly recover, and that's why we took off the recovered data from the website, because we did not think it was accurate. Dr. Burstein, would you like to talk a little bit more about this?
Sure, yeah, thank you. So we know, the good news is that most people who develop COVID-19 do recover, although unfortunately we have some deaths that are very, very sad. It is just a small fraction of all the people that are infected, so we know that most people recover. So far, we haven't been able to say that COVID-19 is a chronic disease and all people do recover. However, just like any type of infection, people recover at different rates. Some people don't have symptoms at all that are infected, and some people it takes a very long time to recover. Everybody's different. And at the health department, when we conduct surveillance, we're not monitoring people who are infected as to their recovery. So we don't have any data specifically on every individual case to tell you, who has recovered or who isn't. So I think you can assume that, in the big picture, the total number of people that are infected, that we report are infected, minus the deaths, are the number of people who either have recovered or most of those we hope will recover in the near future. And so right now it's just an estimate because we're not following all those individuals every day. But again, it's really no other communicable disease do we report recovery, and so this is again just another communicable disease. So I think people can just do the math and then estimate for themselves of the total cases minus the deaths.
Thank you. Mortality data for the 357. Once again, you see that the individuals as a percentage of the population are much greater that have died in the 70 and above category. 23% of all individuals who have died from COVID-19 were 70 to 79, and 53.5% were 80 and above. And as you can see, those two age delineations only make up about 12% of the overall population. So we certainly know that this has a very bad impact on our senior population. That's one of the reasons why we've tried to protect them as much as we can with the pause orders. And then the breakdown, males and females, just slightly more males than females, though we do know that there are more females that live in Erie County than males. Then you look at the mortality data once again in a chart form, graph form I should say, and you can see that it definitely has a huge impact among individuals 80 and over, and there's a greater proportion of the people who died that are 80 and over that are females, where in every other category males are dominant. It could also just be because women generally live older, and they have because of that there's more of them in those age categories than men. The mortality data regarding race and ethnicity, we've been watching this for some time, and once again there was a greater number of deaths for African Americans than what would have normally been the makeup for the population. It has dropped from what it was earlier, but it still is greater than the actual population makeup of African Americans in Erie County, which is a little less than 15%. So we continue to keep an eye on that, and we put our resources where we think we need them to address outbreaks in communities. Now, Erie County responds. We continue to do a tremendous response, and we got some new things to talk about with regards to response today that I think is important for the public to talk about, and we always start out with testing. So I'll turn it back over to Dr. Burstein.
Thank you. So there are a lot of testing opportunities available in our community. We're very, very fortunate in Erie County. We have some great partners that are all testing. So if you want to get tested from the county, and we're actually holding clinics depending on the week, either 5 or 6 days a week at a different point of Erie County every single day. Today we're in Amherst. We've been in Orchard Park. We're going to Lackawanna. We're going to be all over the place. So if you think that you are at risk for any reason, please call us at 858-2929. You don't need any type of physician's order. This is by appointment only, so you have to call. We'll let you know where the clinics are located and when is the next available time. So, and we hope that people keep their scheduled time even if they don't have any symptoms. We do have foreign language interpretation available if English is not people's first language. We just really want to make testing accessible and available for everyone. Also, as I mentioned, we have some great partners in the county that are doing testing. So Kaleida actually rose to meet a need of a void in the 14215 district to offer testing at the Leroy R. Coles Jr. Library on East Delavan Avenue. And they're open Monday, Wednesdays, and Fridays from 9 to 5 for people that are concerned that they have COVID-19. It's by appointment only. It's preferred that you contact your primary care provider for a lab order, just like any other laboratory that we get. It's all really important to loop in your primary care provider. Like, people don't show up for Quest and say, oh, I feel anemic, draw my blood so I can tell my blood count. So it's really the same thing. It's really important to get your primary care provider involved because as the county executive pointed out, some people can have a hard time with recovery, and it's really important that your provider knows that you're getting tested and can follow you for that. So you can go to Kaleida's website, and there's a phone number there if you prefer to call. Kaleida has also expanded testing throughout the community. You see they have locations in Amherst, Williamsville, downtown in Buffalo, in Cheektowaga. And so, again, the same process is in place. Go to Kaleida's website or give them a call. Make sure that you get touch bases with your primary care provider, get a laboratory order. So you should be expecting that when you contact Kaleida to have a laboratory order, except for the East Delavan site. And you can, again, it's by appointment only. There are a lot of different places in the community, so you either give them a call at 859-3222, They're open from 7 a.m. to 7 p.m., or it's actually easier if you go on their website and make the appointment that way. And then our partners at the New York State Health Department also have a clinic, and that's for testing people who are at risk as being close contact or essential employees in any type of profession, including healthcare or other essential employees. Again, it's by appointment only, so you would call their COVID-19 hotline at 888-364-3065, or you can go to their website and schedule an appointment. So that, again, they're on Perry Street in the Cobblestone District, and that's an easy way, also easy way to get a test. And there is no healthcare provider lab order required for that testing.
And before you just move in isolation orders, I know there's going to be an important announcement that's coming from the Erie County Medical Center Corporation on testing. There is no dearth of testing sites. We have plenty of testing available. If you're feeling sick, you should get tested. You can call our Department of Health at 858-2929 and push the right option depending whether you have a doctor or not. You don't need to have a doctor to get tested. We need people to get tested so we can keep this under control. So if you're feeling sick, get tested. If you think you've been exposed, get tested. There's plenty of sites across Erie County.
Thank you. And then the reason we want people to get tested is so we can identify people who are infected and make sure that they're in isolation, so remove them from the community, so to try to break the chain of transmission. And so the question is, okay, who needs to be in isolation? So, people that go in to get tested who have symptoms of COVID-19, when they get tested, they should start isolation at the time that their specimen is collected. Because they have symptoms, there's a very high likelihood that they are infected. So they should be removed from the rest of the community to don't infect people with either COVID-19 if they're infected with that, or some other type of infection that is causing those symptoms. Again, if their test is negative, after that, then they can release themselves from isolation. They don't need to be in isolation anymore. People that go in to get tested, maybe they are contacts or they're concerned that they could be infected for any reason, and they do not have symptoms, they do not need to be in isolation at the time of specimen collection. If those people develop a positive test result, if their test is positive, at that time they need to be in isolation. And all the information about isolation should be provided to you by your ordering physician if you have that, or the site that collects your specimen should also make that information available to you. If somehow that gets missed, it's on our Erie County website at erie.gov/COVID-19. So again, we just want to remember, people who are sick either have a positive test or have symptoms, you need to be isolated, break that chain of transmission.
Thank you, Doctor. We have some good news to announce. We've just received over 1 millionth mask. We have plenty of masks available for our supply for area nursing homes and hospitals. We're getting additionals as we speak. They were delivered today, too. And those will be distributed to nursing homes and hospitals as needed. But we have so much, we're going to distribute up to 500,000 masks to the 3 cities, the 25 towns. We're going to give them to our legislators, too, so that they can distribute them in their own communities. We've had very good success, I should say, procuring personal protective equipment, the PPEs, in the most recent time period, to the effect that we are going to provide a lot of those masks to the general public. So we're hopeful that people will take advantage of this. More info will be coming soon. I'm going to be talking later today with the leaders of cities and towns, explaining how they can pick up the masks, and it's based on a proportion of their population. And then it's up to them to distribute them. But we have had a great success in the personal protective equipment procurement. I want to thank the commissioner of our procurement division, Valley Ferraccio, from the Department of Purchasing. I want to thank William Geary, our Commissioner of Public Works, and Daniel Neverth, our Commissioner of Homeland Security and Emergency Services, for the great work that they and all of their staff have done to help us procure additional PPEs for the greater community, such that hopefully very soon we're going to be distributing out to the municipalities, and they'll be distributing out greater to the community. So you'll be hearing more about that later, but we're very glad we were able to get more PPE. And the picture you see on the screen is of one of our locations, one of our warehouses where PPE was received this weekend and was put on. You can see they're on pallets. That's a lot of masks that were received over the weekend, and thankfully we'll be able to distribute them very soon. Reopening, of course, is a big topic. Everybody knows about what we've been talking about in the 7 metrics. Western New York has met 5 of the 7 metrics pursuant to the data that was received from New York State, and as was noted by Governor Cuomo earlier today. You can see it on the screen. The 2 things that we have not yet met, which is our hospitalization declines over a 14-day period or a 3-day average, as well as hospitalization deaths over a 14-day period or an average, is out of the control of myself, it's out of the control of Dr. Burstein, it's out of the control of many other people, but it is in the control of the public. We need to do what's right to keep these hospitalization numbers down. We're continuing to push New York State for those daily hospitalization numbers. They have the numbers. It's not like they don't have them. They receive them from the hospital. They just had an issue with distributing them out to the local communities. But this doesn't totally surprise me. This is an issue we were concerned about. I said we were going to meet the contact tracing requirements, and we have. New York State's happy with what we've done as a region, and therefore they put us in the checked column. And when it came to testing, we were worried about testing. We said we need to ramp up testing. Well, we have, especially over the last week to 10 days. So we've met the testing requirements. So it's up to the hospitalization numbers and the deaths. And that's something that none of us control. The only thing we can do is I should say none of us control individually, but we as a community do control by continuing to reduce the spread, especially those among vulnerable groups. I was on a conference call yesterday with members of what is now the Regional Control Group, which includes myself, Lieutenant Governor Kathy Hochul, Mayor Byron Brown, the leaders of the other counties and other folks too, including the mayors of the cities of Niagara Falls and Jamestown. And we are working very hard to reopen this community as quickly as possible. But the thing that is out of our control are the hospitalizations and deaths in hospitals. And in some ways, we are all in control of it by reducing the spread of the coronavirus. So we're going to continue to work hard to open as quickly as possible. Some regions, it appears, will open on May 15th, which is Friday. I don't know if we're going to get there yet. It seems a little tight, but we may. No matter what, I do believe we would open by June 1st. And there was a question that was brought up, could we reopen between May 15th and June 1st? And the answer is yes. So if after a week following May 15th it appeared that we've met the standard and the state approved it, yes, we could reopen around May 22nd, May 23rd. It all depends on those hospitalization numbers and what we can do to reduce them. And we're all in this together to help reduce that. And of course, you can learn more about the governor's plan for reopening New York State at forward.ny.gov. And there you can actually read the plan that he talked about and released today. Industries reopened by phase. Phase 1, they listed all of the industries and businesses associated with phase 1. It includes all construction, all manufacturing, all sort of middle mile delivery logistics, as well as retail for pickup or curbside pickup or delivery. And it actually is a lot of retail, including jewelry stores, shoe stores, sporting goods. So those stores would be able to open in phase 1, but every party, every business that is to reopen has to have a plan to safely protect their employees as well as any patrons, depending on what type of business they are. So it is incumbent upon every business to come up with a plan. I am expecting New York State to release this week a template for businesses to show exactly what they want. It's sort of described in the New York Forward plan. I was reading it earlier after it was released, and it does describe what the expectations are for businesses, but they're going to be releasing a template. On my call yesterday with the governor's office, they informed us that every business not only has to have the plan, they have to make it available for their employees to review, as well as any patrons. You often see those sheets on the wall that list like the minimum wage and issues with EEO and sexual harassment and how they have that. Well, every business is going to have a plan. They're going to have to say it's available for review for their employees and their public. If you do not have that plan, you cannot reopen. It's as simple as that. So if you're a manufacturer, even if you've got 3 employees, you got to come up with a plan. Because if your employee says, I'd like to see your plan, Mr. or Mrs. Employer, and you don't have one, you can't open. And as the governor noted earlier today, the localities are responsible for compliance. I'm hopeful that every business in our area that is itching to reopen will have a plan. Because if you don't, then we're going to have to go out there, confirm you don't have a plan, and shut you down again. And none of us want to do that. So make certain you get your plan. The state is going to release the template of what that plan should look like a little later this week. The information is contained in the New York Forward booklet that the governor talked about. And I'm hopeful that every business does what they should, which is come up with a plan to protect their employees and their patrons, and when we eventually get to it, the general public when we return to that phase. It's a 4-phase plan. Phase 1, we are not ready for. We still have to drop those hospitalization and hospitalized death numbers. But I think we can do it very soon because we're all in this together, and I know we can do this. Now, finally, I want to talk about something that I've heard a lot in the last few weeks, and that's people demanding that I do something or Dr. Burstein does something because they're taxpayers. And I want to remind everybody that when there's certain things that government does and who we represent, but too many people forget who government truly represents. We do not represent taxpayers in government. We represent people. It's very important for people to understand that. We represent the youngest child in our community to the oldest adult. They may not be a taxpayer at that moment, but they are important and they are part of our community and we represent them. There's a quote that you see on the screen that I think is very important. The government is concerned with the welfare of those it represents, all of its citizens, not just taxpayers. We as a government represent the youngest child that may need protection from an abusive adult or the oldest adult that may not be able to turn anywhere else other than the greater community to provide for his or her basic medical needs. Those of you who followed me know where that quote comes from. That is from my inaugural address in January of 2012. And there I am, a lot skinnier, with a lot less hair, and certainly a lot less gray hair in that hair. I bring that up because I want people to understand that we represent people in government and we're here to protect the public. So when we talk about reopening our community, we're talking about reopening it safely for all of us. I'm sick and tired of people saying, well, just lock up grandma and grandpa in the nursing home. Lock them up in the house so the rest of us can get with our daily lives. That's not what we do in a community like ours. We are the city of good neighbors. We come together for each and every one of our residents, no matter what age they are. We're going to work hard to protect everyone. I know that's what I'm doing. I know that's what Dr. Burstein's doing. One final thing. Some of you may have heard there was a protest in my neighborhood in which individuals drove around protesting the failure to reopen the community. I have no problem with protests. I think in this protest actually in some ways was a safe one because they were driving in their cars. But they did it in my neighborhood, and I wasn't even there to see it. Though my neighbors told me they drove around for an hour just beeping their horns, saying things, it was inappropriate. My neighbors didn't sign up for this. I did. If you have a problem and you dislike something that I've done, you can protest me. Protest me here in the Rath building. Come here. Leave my neighbors out of it. They didn't sign up for it. I did. So if you got a time, you want to protest, protest me here in the Rath building. Leave my neighbors out of it. There were a couple incidents that happened with people screaming back and forth at each other, one to the point that the police had to break it up. That's not who we are. We come together in a crisis and an emergency, and if you want to protest, you do have a right to protest. Do it in a safe manner, but don't do it in the neighborhoods of elected officials. Don't do it in the neighborhoods of other individuals, because all you're doing is alienating and aggravating the other individuals who are wondering what the heck's going on. If you want to protest, come drive around the Rath building for 8 hours in a row. Honk as many horns as you want, but leave my neighbors out of it. With that, we'll open it up to questions. Okay. All right, if you could just make sure you're muted until I call you. The first, I don't know who we started with last week. We'll just go, it's Monday, we'll start right from the top. AP Albany or Buffalo, anyone on? B News? Buffalo Business First? Sandra Tan, looks like you'll get the first question from the Buffalo News.
Yay. So I have a couple of questions related to hospitalization. One, I'm curious to know what the UB modeling currently shows in regard to the outlook for number of hospitalizations in the coming week. Don't know if that trend line has moved downward at all. I'm also want to follow up on what you had said about the lack of availability of testing data for hospitalizations coming from the county. I'm wondering when you anticipate you're going to be getting that, because obviously that is very much a key metric that everyone is looking at. And if you do get it, is the county free to release that trend data, that detailed trend data to the public, so that we can see how the numbers are trending, or is that something you've asked for?
I'll answer the second portion first and then turn it over to Dr. Burstein. We would release, of course, the trend data. It's my understanding New York State is putting a dashboard up for every one of the regions. This was discussed on our call yesterday. The dashboard will show exactly where everyone is in the metrics by region. I can provide the stuff for Erie County, but that doesn't really match up with what else is going on for Allegheny, Cattaraugus, Chautauqua, and Niagara County, so New York State is putting that up. And then during earlier press conference, Jim Malatras, who's in charge of the dashboard for the governor, announced that the dashboard should be up later today. So hopefully that'll be up for everyone to see on the state's website later today. Dr. Burstein, would you like to take the first part with regards to the UB modeling?
Sure. So Dr. Winkelstein shared his latest model with us last week, Tuesday. We haven't seen an updated model yet. What the model showed last week is, again, we were at a plateau, so our strategies of social distancing, wearing masks, staying away from ill people seemed to be effective in keeping the number of hospitalizations flat, so to preventing an increase. And then again, if we open up the New York pause when we reopen, if we see less social distancing, we should expect that we'll see more numbers of COVID-19 cases, and so that'll all depend. The number of cases and the number of hospitalizations will really depend on, how much people comply and continue to comply with social distancing and wearing a mask and staying away from other ill people. So we're hoping later this week to see an updated model from Dr. Winkelstein. He's relying, as we are, on hospital data. And so since we haven't received updated hospital data in several days, it may be difficult to update the model. So I'll have to touch bases with Dr. Winkelstein and see where he is on that. It's been very frustrating not having access to the HERDS data. Every time we ask the state, what's up with the HERDS data? Why can't we have access to it? They give us, they advise that they're having some technical difficulties, and we should expect to have access to it soon. So I know that's where we are. We're, again, we're hoping to have access. As the county executive mentioned, he's reached out to each of the hospital CEOs to be able to provide us directly with those data, so we don't have to rely on the HERDS data. So hopefully we'll have some data from some source to provide you in the near future.
Do you have a follow-up at all?
It does look as if you...
I guess so.
Yes, I mean, it does look like you have some data regarding new hospitalizations. That was red last week and is green this week. You've moved down below 2 to 1.45.
Right, I believed we did receive some data for May 7th. Those were the last data that we have.
Right. One thing I would remind you, Sandra, is we haven't gotten it, but the state does. They receive the data from the hospitals. They're having an issue with distributing the information in a form that can be used by local governments. So it's not like the state doesn't have the data, and that's why it dropped. I'm not surprised to see that. I mentioned last week it looked like we were trending in the right direction, where we were having growth less than 2.0 of new cases being hospitalized, so I'm not totally surprised. I mean, 2.0 out of, 100,000? So that I was actually not surprised to see we met, but unfortunately, we rely on the data from New York State to confirm it on our end. And you also have to remember, when they're looking at it from a regional basis. Erie County is the largest portion of it, but we're not the only one. There are hospitals in Niagara County, Chautauqua, Cattaraugus, so I think it's important for us to understand that we're really kind of at the mercy of the data as it pertains to Western New York, and New York State controls all that data right now. Spectrum News, Ryan and Ellen, I believe.
Ryan and Ellen, I believe.
Hey, Mark. Ryan Whalen here. How are you?
I'm good, Ryan. Good.
Can you hear me?
Yeah, I can hear you. Go ahead.
Ryan.
Good. Okay, I just had some questions about your executive order from Friday. I'm looking at the Erie County Charter, and I'll spare everybody reading through the entire thing, but essentially the language says that if there appears to be cash flow projections that are less than the anticipated expenses for the rest of the year, then the county executive or the controller shall submit a report setting a deficit procedure into effect. So the county controller's stance is that he was mandated to set this procedure into effect last week. Do you agree with that? And if you don't, I'd like to hear why. And then to the executive order that you issued Friday, the county controller basically compared that to a president using an executive order to overrule the Constitution. Do you agree with that representation, and what portion of the law allows you to override this charter procedure?
Well, with regards to the second part, it is not the same as overriding the Constitution. But New York State law is very clear. We are an arm of New York State government. We are not a separate country. We are not a separate state. So we can do only anything that we're given power by New York State. And New York State county law provides for the creation of a charter county, which is what Erie County is, which means we can have our own rules of operation. But New York State executive law specifically says that in an emergency, in a state of emergency, the executive can overrule certain rules and laws, including what would be considered the charter of a county. There's actually case law from this in the past. So what we did is we thought it was inappropriate at this time to declare a deficit, which goes to your first portion. The budget monitoring reports that we've issued so far actually show us to be in a surplus. We have a concern about the future. There's no doubt about it. Cash flows are under the control of the controller, and he has a way of addressing that by issuing a revenue anticipation note, which I believe was approved. He hasn't done it yet, but we certainly can issue a revenue anticipation note. But New York State executive law gives me the power in the state of emergency to amend rules and regulations as necessary, and what I did was amended this portion of the county charter to give me from 7 days to 30 days the opportunity to respond. We're right now in negotiations with the federal government with regards to what we may actually receive as part of a CARES package 2.0, or it would really be 4.0 stimulus package. So the law is on my side. As an attorney, I know that. As the former county controller, I know that. And I think it's just important that people understand that his accusation that I'm basically overruling the Constitution is incorrect. He needs to understand that counties are subdivisions of New York State. Our powers are granted by New York State. We also can follow the rules and laws associated with New York State. New York State executive law gives me the power to declare a state of emergency and enter into emergency orders. And as such, I did, and I acted appropriately under the law. Next question. I guess there is somebody from WBFO on?
Mike.
Hi, Michael.
Have you had enough time, or Dr. Burstein had enough time to see if there has been a death rate overall for the county that is higher than expected? I mean, it's the New York City situation where there are thousands more deaths, but nobody knows if they're COVID deaths because have you seen a higher rate of death in the last 2 months than you would have on average of recent years?
Well, for those who may not have heard it, Mike Desmond from WFO asked, have we seen a higher rate of death in the last 2 months than we have seen in recent years? We have looked at that as best as we can. Our medical examiner's office does not get all death data. It goes to New York State. We get suspicious deaths like suicides, drug overdoses, murders, homicides. We do not get every death, and that data goes to New York State first, and eventually it gets into the system. So I cannot, and we cannot answer a higher rate with regards to overall deaths. We did last week talk about the impact because I wanted to look and see based on what our medical examiner's office viewed with regards to overdose deaths, and there was a slight increase from 2019 and 18, but it actually was lower than the numbers in 2017. So those are suspected overdoses. We don't have confirmation on them yet. And we're trending basically the same as usual with regards to overdose deaths at this point. So there's not really that much of a difference on a year-to-year basis. It's a little bit higher, but if you look at it compared to where we were in 2017, we're lower. We do not have access to all the deaths yet. It goes to New York State, eventually it gets put in the system, and then we can do a comparison with prior years. How'd I do with that answer, Doc?
Spot on. You could be an epidemiologist.
I guess I could be a contact tracer.
So does New
WG,
York City get their data differently because there are numbers for New York City?
yes, they do. New York City has a totally different system. It's handled in a different manner than New York State, and it's the only one that does. There are 5 counties in New York City, the 5 boroughs, but they are treated differently in so many different ways than the rest of the counties in New York State. WGRZ TV, Leanne Stuck.
Hi, Mark. Leanne Stuck here. My question is in regards to testing. If you look on the State Department of Health website, it shows that Erie County performed 386 tests yesterday, which other days throughout that same week, the county was performing triple the number of tests. Are you concerned that if the numbers we saw yesterday continue, that the county will not be able to meet the requirements to reopen in terms of testing?
I'm not so, because I believe it was a weekend and there's less sites available on the weekend. A lot of doctors' offices that were doing testing are closed. The county was not testing on the weekend, but we are testing 6 days a week now. So we've ramped up our testing, so what others. I think a lot had to do with the weekend. I don't know exactly if the data that's on there today was listed for Sunday or if it was for Saturday, but I do know that on average the test numbers go down on Saturday and Sunday just because there's less testing. In general, the testing on the weekend is predominantly being done by hospitals, the individuals who come in and they may be at risk for COVID-19. A lot of the other sites are not open on the weekend.
And thanks, Mark, if I may add.
Yes.
Many times on Monday mornings, there seems to be like a little bit of backlog with the eClear system reporting out the data. So, and then all of a sudden on Tuesdays and Wednesdays, we get these huge numbers. So, again, these are reported tests, not the actual tests that were done. So, we'll have to, that's why we'd like to look at the data by week, not necessarily by day, because there can be a backlog with the eClear's reporting.
Okay.
Thank you.
You're welcome. WIVB TV, Kelsey Anderson.
Hi, Mark. I know we haven't gotten the numbers from New York State, but since you've reached out to the hospitals yourself, do you know whereabouts we are in that 14-day decline in hospitalizations and hospital deaths? Like, are we in day 2? Are we near day 10? And then if we're in a plateau, does that count as a decline or no?
You have to look at it on the rolling average based on the days over the 2-week decline. We were showing a decline, but where exactly, how much, I can't say. We have too many days lost data to say that, yes, this is exactly where we are. And I'm hopeful that we'll have all of that data. We've requested it from the hospital systems. We've started to get it in. We haven't gotten all of it in. And remember, it also, when the state is looking at it, it's looking at it as through all of Western New York. We do not have access to the data in Niagara County or the other 3 counties, Allegheny, Cattaraugus, and Chautauqua. I'm hoping that the state's dashboard is up later today like they said it was going to be, so that we can actually, everyone can see it. It'll be updated every 24 hours. So there'll be no question as to where the region is when they compile all the data for Western New York. WKBW, Ashley Rowe, Ed Riley. Anybody there from WKBW? Are your phones muted? If not, oh, they had a question, excuse me, they did have a question. Latest on approval from New York State to allow RV camping. Very good. I have the official answer here. New York State has deemed campgrounds as non-essential and therefore should not be operating across the whole state. We are still working with them on rules that would allow some seasonal campers, but have not gotten an approval order yet. Now, and this is what probably people are wondering about, what about other counties that have allowed their campgrounds to open, many issuing a certificate from their own Department of Health to try and get around the state order? Those campgrounds and counties are acting improperly. Those counties are liable. We haven't done anything like that in Erie County because it would be breaking state law. We have gotten official confirmation from New York State that campgrounds are non-essential. We are trying to amend our prior order that allows RVs to, with their own self-contained restroom facilities, to operate, but the state won't approve it because campgrounds are deemed non-essential. We are doing our best to work with others to try to get that done. I know a lot of people are not going to like to hear what I said, but New York State has informed us that campgrounds are non-essential and therefore should not be operating across the whole state. And we're working with them on rules that would allow other seasonal campers that have not gotten approval. If any county is allowing campgrounds, they're doing it in violation of New York State and are liable for it. So if somebody got sick at a campground and it was community transmission and those were improperly operating, it's arguable that they could be liable for the improper operation of the campground. A lot of people aren't happy with me about the campgrounds. Once again, as I said, we represent people, not taxpayers. We're here to protect the public as best as we can, and this is an enforcement of a rule, and therefore, until we get further guidance from New York State, we are in that same position. I'm hopeful that we'll be able to lift the campground order, but we need the approval from New York State to lift it. They had no problem with me with the order earlier because they had deemed campgrounds to be non-essential, so we're working on it. Go back up to the top. Anybody else I did not call upon is on the phone?
Yes, Mike Baggerman from WBEN.
Okay, Michael. Sorry about that. Welcome aboard.
No problem. Mark, I'm trying to get an understanding of where churches would fall on the reopening efforts. And there's also a second part to this question, and this regards events at churches. Obviously, there's masses that happen there, but also I've been getting a lot of people asking me about weddings in particular. Would those be considered separate events? Any kind of comment would be appreciated.
All I can say, Michael, is we're trying to get the same guidance from New York State as well. Churches right now have not been identified in any of the phases. I imagine they would be in the phase 4 if they're not going to put them any other one, but they might include them in a further phase. But even then, the churches have to do what is appropriate to limit capacity, to ensure the safety of their parishioners, their congregation. So until we get further guidance from New York State, I really can't, unfortunately, offer anything. Once again, this is not a county by county or region by region decision. This is New York State setting the standard for the entire state. So a lot of folks are like, oh, you can override the state? The answer is no, we cannot override the state. So until we get further guidance from New York State, unfortunately, I cannot answer the question. We're going under the assumption that it would be in phase 4, but it's possible it could be an earlier phase. It all depends on what New York State decides is safe for churches, synagogues, temples, mosques, and until we get that, I can't really offer the answer. And going back to Sandra Tan of the Buffalo News.
Hi, I had a question about where we stand with contact tracing. I know that the county's in the process of training a new slew of contact tracers. I was curious to know how many non-essential employees the county has now who don't have other work to do and are being paid. How many of them will be retrained as contact tracers?
I can't answer that exact number. I'll have to get the personnel department to get you that number with regards to the number of individuals who are non-essential that are at home right now. We have identified a few hundred right now, contact tracings. The state is very happy with our numbers, and they're planning on also doing their own hiring, so they feel comfortable that we'll be able to meet the contact tracing needs. We can meet the contact tracing needs now because we have been contact tracing throughout the whole period. Dr. Burstein's been working with the personnel department to ensure that we have appropriate contact tracers and they're trained, so I'll turn over the remainder of that question to her. But when it comes to the contact tracing, I'm very glad that the actions that we took proactively have allowed us to eliminate that as being a metric that was unattainable because we have reached it already in the state's eyes. Dr. Burstein?
Sure, thanks. So right now, with our current number of contact tracers, we're able to contact, reach out and call every single new case that comes to us every day. So there's nobody that's left behind because we don't have enough staff by the end of the day. Sometimes we don't go through to everybody, and we make sure that we try to reconnect with them later that day or the following day. But right now, we have enough contact tracers to meet our need with the number of cases that we have. With the expansion of the state's contact tracing system, they are supposed to be releasing a specific training that is supposed to be several hours from what we've heard that all contact tracers in New York State will be required to take. and that will lay out the plan for their strategy for contact tracing. And so we'll have a better idea of what they're thinking of, and then we'll have enough staff to deploy to do the contact tracing and that model that they seem that is fit, and we'll be able to again meet the needs of the state to get to our reopening phase. So we, again, we're waiting for the state to release that training, and all the people that are currently contact tracers, and again, all the people in the wings that will be available to be contact tracers will receive that training, and then we'll have a better idea of how to use that additional staff if and then when we need them.
Okay.
Do you have an exact number of contact tracers that you need?
From Erie County, it's 277.
Okay, thank you.
You're welcome. Spectrum News, any other questions?
Yeah, just one more for you. Governor Cuomo's been talking about how we didn't know the spread of coronavirus started way earlier than it did, that it came from Europe. And so it was obviously here well before we started testing and identifying all of this. Is there any cause of death that are being investigated further back before we started tracking coronavirus to see if they could have possibly been due to the virus?
I do not know the answer to that question. I'll turn it over to Dr. Burstein.
Sure. Well, the current hypothesis is that in New York State we started to see an upswing in coronavirus in our state back in February when people were traveling to and from Europe on holiday or for business, and starting in February when they started to have those outbreaks. As far as I know, as for us in the county, our medical examiner is not doing any investigations for COVID-19, because again, those are deemed natural deaths. They're not suspicious deaths. They're not suicides, homicides, drug overdoses. And so, to my knowledge, the state. We haven't heard that the state is backtracking to try to determine if cases that have people who've died already in the past back in February were died of COVID-19. They do have a new category that on their tracker site of suspicious cases. However, we're again, this is something that's deemed by the state, and it's not that the county is investigating.
Thank you. WBEN, Mike Baggerman, any other questions?
Yes, just one more, and this regarding nursing homes. I know you had touched on it a bit on your press conference on Friday. I'm just wondering if you've learned more about the situations that have been happening in places like East Aurora, Orchard Park, etc.
We've gotten a little bit more information from New York State, but New York State is directly involved with those nursing homes. The Orchard Park Baker Manor nursing facility is pretty much a COVID-only facility at this point. Other facilities have non-COVID and COVID-19 patients, but my understanding is Baker Manor is a COVID-only facility at this point. It's receiving cases from across the various hospital units. The New York State put out further guidance with regards to who a nursing home can accept and who it cannot. And I would suggest you contact New York State with regards to further information on that guidance. It talks about who a hospital can release to a nursing home and who a nursing home can accept. It's my understanding, and Dr. Burstein, please correct me if I'm wrong, but if a hospital has a patient and they're still COVID-19 positive, they cannot be released to a nursing home.
That's correct.
So they've changed the rules with regards to release of patients to nursing homes. If they are coming from a hospital and COVID-19 positive, they cannot go to the nursing home.
However, if I may add, the hospitals have been working on trying to solve this problem, and they have established both on the Kaleida ECM side and on the Catholic Health side these subacute care facilities. So they're not nursing homes and they're not acute care hospital beds. so they wouldn't be counted in the hospital admissions. However, they wouldn't be nursing homes that would be forced to take COVID positive patients. And these subacute care facilities are really designated for patients who are still positive with COVID-19 and need some type of medical support. So again, as a community, our hospital systems are really working on addressing that problem, again, to keep the admissions down to only the people that really need to be in the hospital. So again, help us get to that point where we can reopen Erie County.
WBFO, Mike Desmond, are you still on? Do you have any more questions?
Yeah, consistently in the charts you put up on the essentially racial breakdown of people who've been hospitalized and died from the virus, the African American community has obviously been hit much beyond their percentage of population, but the Latino population has been kind of consistently below. Any idea why?
I really don't know. I'd only be speculating. I don't know if Dr. Burstein has any ideas.
It's really difficult to say. It could be an issue of, reporting of how people are documenting race, ethnicity. Or it could be of, what disease is in what type of neighborhood or social network. So there can be many possible explanations. We're not really sure which is it. It's probably a combination.
Okay, thank you.
WGRZ, Leanne Stuck, any other questions? If not, Kelsey Anderson, WIVB, any other questions?
No further questions. Thanks, Mark.
Thanks.
Just look forward to your conversation with John and Jackie at 5. Thanks so much.
Yes. And finally, WKBW, Ed and Ashley, are you still on? Any other questions? If not, I want to thank everybody once again for tuning in to our latest COVID-19 outbreak briefing here in Erie County. We are headed in the right direction. I thank everybody for the good work that they've done to help us get it there. We understand that we're not out of the woods yet. We still have a couple more metrics to meet, but those metrics can only be met by the greater community. It requires all of us to act appropriately so that we do not spread coronavirus to others and then they contract it and catch COVID-19, and which can be, as we all know, very serious. It's killed too many people in our community, far too many people. There are people still in hospital today. If we can ensure that that hospitalization number goes down, the death number goes down with hospitalizations, we will be able to reopen into phase 1 very soon. It's possible we could meet it for the May 15th guideline, but we need to do a little bit better so that we meet those metrics. If we don't, I do fully expect us to meet it by June 1st and hopefully sooner, but it's incumbent upon all of us. We're in this together. Let's continue to be our brothers and sisters' keeper, and remember that this is nothing that anybody wished on. I certainly don't want to have wished on it. I need a haircut like so many other people. It's getting pretty long back there. Everyone's commenting in my office about how much product I'm using to keep my hair in place. Let's do what we can to reopen it so I can get a haircut, you can get a haircut, we can go back to more of what is normal, but know that this is something we're going to be dealing with for the future. Thank you, everyone, and most importantly, be safe and well. Take care.